The COVID-19 pandemic strained healthcare services across Canada, but the crisis had begun years before the pandemic hit, due in part to rising healthcare costs and an aging population. Today, it faces enormous challenges as demand for healthcare services increases and more healthcare workers enter retirement. As in previous elections, healthcare is a key issue for many Canadians. According to an Environics research survey conducted in July of 2024, 80% of Canadians said the shortage of healthcare workers, including doctors and nurses, was a major concern. 74% said healthcare in their province was in crisis.
Certainly, some of the key challenges are primary care. You hear about this many, many times, access to primary care, how well supported primary care is in this country. We have a very insufficient system there. Another area is around the area of integrated care. So people who have multiple conditions, they are off seeing many, many different specialists in many different parts of the healthcare system that don't work together and collaborate together.
And those challenges come with a cost.
When we look at the growth in health spending in 2024, we're seeing an annual growth of just under 6%. When we compare that to trends, we see actually a shifting in the pace of growth to a higher gear. I guess looking forward, we expect to see continued increases in spending. What we're seeing last year were policymakers making continued investments into healthcare, and we are still seeing demand for healthcare services. So the underlying conditions for a 6% rate of increase per annum are still there.
In 2024, the Liberal government increased healthcare spending to cover the costs of two new bills on dental care and pharmacare.
We're investing $200 billion to help provinces, territories, and Indigenous partners improve healthcare results and outcomes for Canadians. These investments will, among other things, make it possible to train more doctors and nurses. On top of this, we're also launching the first phase of a national pharmacare plan.
NDP leader Jagmeet Singh says it was his party who secured additional healthcare coverage for millions of Canadians as part of their coalition agreement with the Liberal government.
We have been able to achieve something New Democrats have fought for generations. This has been a long dream of New Democrats. Since Tommy Douglas, we've dreamed of making sure our healthcare system would include medication coverage. And now, pharmacare is the law of the land.
The pharmacare plan aims to give millions of Canadians free contraceptives and diabetes medication. The dental care program covers seniors, children up to 18, persons with a valid disability credit, and those whose family income is less than $90,000. Conservative Party leader Pierre Poilievre voted against both dental care and pharmacare legislation. While the Conservative leader has not committed to keeping both plans if he forms the next government, he does say most Canadians are covered already by their private insurance plans and do not need the Liberal government's pharmacare coverage.
I encourage him to find one example where I've not voted to increase healthcare transfers. We voted, when I was in government, we increased healthcare transfers by 70%. Because of Stephen Harper's courageous leadership and strong books, the NDP voted against those increases. Now, they propose a pharmacare scheme that would ban union workers from keeping their private pharmacare plans. Unions have fought too hard and too long for the drug plans that they have to have the NDP ban them for using what it calls a single-payer system.
Bloc Québécois leader Yves-François Blanchet supported both bills while reminding the government healthcare is a provincial jurisdiction. Green Party co-leader Elizabeth May also voted in favor of both bills. As the government worked through the implementation of these bills, Parliament was prorogued, leaving implementation and coverage for Canadians in question. For Canadians to receive the pharmacare benefit, the federal government must sign an agreement with each province and territory because those governments are responsible for healthcare and funding disbursements. Many provinces and territories have yet to sign a deal with the federal government on the pharmacare plan. The dental care program is only partially in place. While seniors and children under 18 are now covered, eligible adults aged 18 to 64 years set to receive dental benefits this year are waiting in limbo as their coverage was not in place when Parliament was prorogued.
I'll put a first priority on the pharmacare plan, because without pharmacy, people can't receive adequate care for their treatments. Even things like diabetes, if people don't have insurance, like I have a private insurance through my employer, and a number of people do, but many people do not have that kind of insurance. And therefore, if they are younger people who have diabetes, they can't control it. And if they can't control their diabetes, they will have cardiovascular problems in the future, which will lead to heart disease, which will lead to hospitalizations and early mortality. So that's what I mean by not having appropriate care and sufficient care in the community. So having fully funded pharmacare for the entire population, not only those people who are either over 65 or have reasonably secure, well-paying jobs that come with that kind of health insurance with pharmacy. Pharmacare is an essential part of the health system.
When you think about total health expenditure pie, 70% is paid for by governments and another 30% from private sources. As we look to the future in terms of dental care and pharmacare, what we'll be looking for is potential shifting from privately paid to more governmentally funded.
And for voters in this election, next steps for both plans and who pays may be an issue when they cast their ballot.